Late Night Health continues. I'm Mark Alyn. Our wrap-up of today's show, we're going to be talking about dating, and we're going to be talking about being stalked by somebody you used to date. That's happening in about 10 minutes from now here on Late Night Health. Right now, we're talking with Dr. Mark Menolascino. Dr. Mark Menolascino, Medical Director of the Meno Clinic Center for Functional Medicine in Wyoming. And we're talking about stress for our kids. Do you think that this, some stress is good, Dr. Mark? Some stress works for us. For example, being on a radio show, there's a certain level of stress. You don't know if the host is going to go ballistic on you or not, yell at you, scream at you, and that's a certain stress level just before. Being a host, there's a stress. Gee, if I ask a question, is the guest going to answer yes, no? That kind of thing. And what do you do? So but those are kind of good stresses. Stress can cause all kinds of diseases. We know about heart disease. What other things, problems can stress cause, and does it start early in life?
Well, that's a great question, Mark. And the recent studies talk about these adverse childhood experiences that are tied to later in life illnesses. So we definitely know that the stressful events that children are exposed to not only affect them as children, but affect their health as adults. That's why it's so important to recognize them. The way I like to share stress with my clients is that we all have some stress. What's really important, though, is how you internalize the stressor. And a great example is several winters ago, we had a huge snowstorm, 4 feet, covered everything. The first patient came in and she said, "Oh my gosh, I love these storms. The trees are beautiful. Look how beautiful the mountains are covered in snow. I love this kind of snowstorm." The very next woman came in and said, "Oh my gosh, I hate it when it snows like this. I'm going to slip and fall and break my neck." So you had two of the same external stressors causing two dramatically different internalizations. So that's one thing, again, that our kids model our behavior. When we're stressed as parents, the way we respond is going to be reflected in how our children respond to these stressors, because there's good stressors and bad stressors. There's not a lot we can do to control most of them, but we can control how we respond to them, how we internalize them, and what we do with them, whether we turn to healthy behaviors, whether we turn to unhealthy behaviors. Our kids will see that. And so our job is to model the good, healthy behaviors. And again, for kids, the stress, it shows up physically with digestive issues, stomach pains, headaches, vague kind of joint pains. It shows up as sleep issues, behavioral issues with irritability, social withdrawal. It can show up very sneakily and not be so obvious to a parent. So you really have to watch your child's behavior. And if you see a change, take a look at what might be driving it, particularly some stress that's been difficult for them to handle or even identify.
Or you can just have a very super smart kid who says, "I have a tummy ache. Can I stay home today?"
Exactly.
Several times a week. Well, we won't talk about that. And then when you take them to the doctor, the problem seems to mysteriously have disappeared.
Well, that would be a red flag for me. And again, there are holistic things, as we talked about, really looking at what the kids are eating, making sure their blood sugar stays even, getting these proteins, these stress-reducing crunchy vegetables. And again, when you're looking for medication, turn to the clean over-the-counter. That's Genexa's Calm Keeper Stress Relief. It's really a great solution to be your next go-to. But do incorporate all the lifestyle factors first.
And that's okay to drug your kid?
Well, there's, the medications are needed. And what my message today is that take a look at what medications you're using. If they're red and blue, then you know right away that there's a toxic dye that they've used. And a lot of these dyes, particularly the yellow dye, has been linked to hypersensitivity. So we know these aren't benign chemicals. And I think having an organic, non-GMO, clean, over-the-counter solution like Genexa Calm Keeper or stress relief, you really do have a go-to that you can try first before you see a doctor and get other medications. These are FDA-approved medications, but they don't have the side effects or the toxicity associated with most other medications.
Do they follow the homeopathic pharmacopoeia?
They do, and that's what allows them to be FDA regulated. They are formal medications, and the beauty of that is that they're very small levels of active ingredient that have healthy benefits without side effects. And to have that type of profile in a medication is very difficult to find. And so it should really be the first go-to for any parent or physician.
And then the crunchy, I like the idea of the crunchy vegetables. I find carrots a little sweet. I do eat a lot of carrots. I like them.
Throw a little nut butter on there, then you get the protein balance with the sugar of the carrot, and it balances each other out. It's really all about blood sugar for kids.
And that's also good for adults as well?
Fantastic for all of us.
Got it. Well, we really appreciate your spending some time with us today, Dr. Mark, the medical director of the Meno Clinic Center for Functional Medicine. Thank you, sir, and
Thank you.
Look forward to our next conversation. Coming up next, we're going to talk about dating and the stress of dating, especially when you're being stalked. Visit us at latenighthealth.com, latenighthealth.com.